we'll talk about some important specifiers in conduct disorder. Now, the first specifier we'll talk about is severity. So, severity is classified into mild, moderate, or severe, and this is based on the number of symptoms and the degree of harm to others which is caused by the symptom. So based on these, we have divided into mild, moderate, and severe. So what is the level of severity? Again, that can vary mildly from relatively mild lying or stealing, and that can go to severe symptoms like severe aggression, which is involving serious harm to others, involving use of weapon, or there is forced sexual activity. So again, it can vary from mild to severe categories. So let's discuss what is mild conduct disorder. When we add this specifier mild, it means that few, if any, conduct problems are there in excess of those required to make the diagnosis are present. So the criteria which is required to make the diagnosis, usually that is there. So the number of symptoms required to make the diagnosis, or maybe just few more than that, are present in the individual, and they cause relatively minor harm to others. For example, lying may be present, or truancy, or staying out after dark without permission, or other rule breaking. So such kind of relatively milder symptoms may be present, and also the number of symptoms required are just fulfilling the criteria, or maybe just few more than that. Then we call it as mild. Then what is severe? Severe is when many conduct problems in excess to those required to make the diagnosis, they are present. So we discussed at least 3 should be present. So the child may having many more of those criterias. Or the conduct problems, they are causing considerable harm to others. For example, there is forced sex, or there is physical cruelty, or there is use of a weapon, stealing while confronting a victim, or breaking and entering. Such kind of more severe symptoms causing more harm to others that are present. So then we call it as severe.